A very good afternoon all. So I'll be talking about the importance of documentation. So this documentation is not only important in the aspect of NABH, but as a doctor these days this documentation is playing a very important role. So this word holds so true that in spite of doing everything, if you have not documented in your case sheet or any records, it is as good as not being done. So medical records are the only thing which saves you in the court of law. So anything which is documented, the only thing which you can carry to the court of law are the documents. So you have to be really careful in documenting things. So the documentation process starts right, as sir told, right from the time the patient enters your outpatient department till the patient leaves the hospital. So once the patient enters, he gets a unique identification number, and followed by name, age, and all the patient demographics will be there. So the vision, brief ocular history, and all the systemic disorders, everything should be documented. The most important thing, wherever you document anything on the case sheet, there should be a doctor's name, registration number, date and time of evaluation, along with the complete signature of the doctor. This is at most important because this helps in tracing the doctor whoever has entered the reports. So not only the doctors, even the refractionist who is doing the refraction should have a seal and a signature along with the date and time, and also the nurses who record the blood pressure, any duct examination, any other evaluation, everything should be documented along with the signatures. Even the final evaluation in our hospital, since there are around 200 doctors working, a preliminary and a final examination, everything will be done by a different doctor. So it is very important that the final advice, whatever is given, should be on the right hand side of your case sheet, and again every doctor's name and signature is a must. So coming to the consent forms, every simple procedure, right from foreign body removal to the suture removal, any outpatient procedures or any inpatient procedures, everything should have a consent form. So consent form should be bilingual at least. So if the patient doesn't know the language, you should explain the same in patient's own language, and the same thing should be written on the case sheet, that the details are explained to the patient in his own language, and that should be duly signed. So all consent forms should be in the hard copy. So general anesthesia, of course, should have a separate consent form. General anesthesia should have a pre-assessment records, a detailed anesthetic record, all the post-operative recovery records, and during the time of shifting, they should have the shifting details, the orders to be carried out in the wards, and also the condition of the patient while shifting from the recovery room. So coming to who can sign the consent forms, any patient above 18 years of age can sign the consent forms. If the patient is less than 18 years, a parent or the guardian can sign it. In case of a mentally ill or an unconscious patient, parents or the next of kin can sign the consent forms. So every consent form should be countersigned by a witness, and there should be a doctor's declaration also. So I'll just show a sample of a consent form. It should have a name, MR number, age, sex, date, and all the details regarding the procedure, the benefits, the alternative procedures available, everything should be depicted in the consent form, along with the signature of the witness, the patient himself, and the doctor, along with date and time. So coming to surgical records, in our hospital, since it's a big institute where around 500 to 600 procedures are done daily, this documentation only helps us to trace the patient's records. So a complete, thorough assessment records should be there. There should be a pre-assessment records, procedure details, all the materials used during the surgery should be documented, any complications, and also the post-operative advice. These are the few pre-operative records which are verified at different levels, right from the counseling, the nurse, even the during the anesthesia, all the these are the checklists, as sir told, to prevent this any errors happening during the procedure. So the procedure record should have every material that is used during the surgery should be traceable, along with the batch number and the date of usage, and the details of the procedure should be in detail. We have everything in the case sheet. All that we do is just go on ticking the procedure which is done. Every step has options there to check. So even the complications, anything which has happened during the procedure should be documented, and all this after the end of the procedure, the surgeon should duly sign this procedure record. So discharge summary is the one which the patient takes it back home. So it should have all the details which the patient has undergone during the hospital stay. It should have a diagnosis, reason for admission, the procedure done, any complications, condition of the patient at discharge, the post-operative treatment, what to do in case of any emergency, whom to contact, and definitely the signature of the doctor should be there. So what in case of if you're giving a verbal order over phone or through a message, so the one who receives the verbal orders should document it at the time and when the verbal order was given, and it should be gone back. The doctor should go back and sign it within 12 hours of giving the orders. So any high-risk medications, if you are using, it cannot be given with the verbal orders. So when it comes to medical legal case records, any suspected alleged history of trauma, AR entry is a must. So all the medical legal records should be retained for a longer time than the routine case records. So usually it is preserved for a minimum of 10 years, or sometimes if there is a case going on, it has to be saved for a longer time, so or until the case gets disposed in the highest court. So the records can be produced whenever it is required and maintain confidentiality and security. So who can access the medical records? Of course, the patient. All the patients have the right to access their records and obtain the copy, and any legal representatives, other healthcare providers, parents in case of a minor who is if the patient is a minor, parents can get it, court of law, and for the research purpose, provided the patient's identity is not revealed. Coming to the NABH documents, documents are nothing but the established guidelines which are controlled and reviewed at regular intervals. These are the evidences to show the work pattern. So every document which is maintained should have a documentation identification slip with a unique registration number, which should be periodically reviewed. So these are the few manuals: Apex manual, department-wise manuals will be there, system procedures, health and safety procedures, standard operating procedures, hospital committee book, and NABH checklists. So the Apex manual should contain the mission and vision of the hospital, hospital quality policy, organogram, scope of services, key indicators and codes, statutory and regulatory requirements, and the committees. So department-wise manuals should be maintained in infection control, emergency preparedness, medical records, human resources, CSSD, and biomedical wastes. So standard operating procedures should have a step-by-step approach to the procedure which ensures smooth functioning. So hospital committee book should have the committees which are present in the hospital and the members and the roles and responsibilities of each person in it. So with the situation of the current doctors being like this, so only the documentation can save you from all the medico-legal issues. So document, and document. Thank you.